Good morning, good afternoon, depending on where you're joining us from across the WHO region of Europe. On behalf of the WHO Regional Office for Europe, I'm delighted to welcome you to this special consultation of the Pan-European Commission on Climate and Health. A warm welcome to all our online participants, particularly our 11 esteemed commissioners and our Chief Scientific Advisor for joining us today. Ladies and gentlemen, the purpose of today's consultation is for the Commission to hear directly from cities, regions and their networks. These local voices represent communities living the realities of climate and health every day, facing heat waves, floods, air pollution and the heavy pressures these place on health systems and societies. Their experiences show us where evidence turns into practice, where the gaps still exist, and where innovation is already driving change. By focusing on the local perspectives, this consultation will help shape the Commission's final call to action, ensuring it is practical, inclusive, and impactful, rooted in the daily realities of communities. Before we get started, it is my great privilege to introduce my dear friend, the Director for Health Systems for the WHO Regional Office, Dr. Natasha Azzopardi-Muscat. Natasha, thank you for being with us today. You, of course, have a deep experience across health systems and for your long-standing commitment to patients and communities. So what I'd like to hear from your perspective is how do you see local leaders across cities, across regions, strengthening the resilience of the communities, the resilience of their health systems in the local settings that they serve.
Thank you, Rob, and good morning, good afternoon, colleagues, friends, distinguished guests. It's truly a pleasure to join Rob in welcoming you to today's consultation, and I want to begin by saying how grateful I am that so many of you from cities, regions, research institutions and partner organizations have taken the time to join us today. Your presence speaks to the commitment we all share, protecting people's health in a rapidly changing climate. And yes, for many years, including my time in my home country, Malta, my work in health systems has shown me just how closely climate resilience and strong health services are connected. And I have seen time and again that the real drivers of progress are local leaders, because you are often the first to witness the impacts of climate change in your communities and the first to respond, whether by strengthening emergency systems, designing safer public spaces, or finding new ways to protect people during extreme weather. You are the heartbeat of resilience, bringing deep knowledge of the needs of your communities and innovative solutions. And when these efforts are complemented with the resources and planning capacity of cities, the regional coordination of governments, and the technical expertise of health services experts, of course, the impact multiplies. And it is this nature of collaboration that enables integrated planning and shared data and strong governance, while also unlocking joint investments, nature-based solutions and experimental approaches like urban living labs. Together, these multi-level collaborations strengthen emergency preparedness, improve infrastructure, enhances ensuring communication and engage communities, reducing health risks and accelerating climate action across all levels in countries. This is why today matters so much. We meet at a moment when climate pressures are accelerating across our region, but political commitment in many places is on a diverging trajectory. Yet solutions coupled with sustained commitment to act often emerge locally and are some of the most practical, innovative and hopeful examples we have. So our agenda today reflects this, and we will hear from mayors, regional representatives and city leaders who are showing what is possible, not in theory, but in real communities under real pressures. Together we will look at the growing evidence that local climate action delivers immediate health benefits, and we will explore how cities and regions are moving towards carbon neutrality and climate resilience, often despite limited resources or complex governance landscapes. So for this, I am especially glad that we will begin with a high-level dialogue between European city leaders and Her Excellency Catherine Jacobs-Dottir. It's great that we are able to be with you here again today. Your leadership, your commitment, linking climate policy, well-being continues to inspire all of us across the region, including me personally. So thank you once again for being here with us, for supporting WHO's efforts in this area, and I really look forward to a discussion that energizes us, challenges us, and brings us closer to a healthier, more resilient future for everyone, everywhere, irrespective where they live. Rob, back to you.
Thank you very much. That's a superb introduction. Really grateful for that reflection. Also, a great thanks to you and the Healthy Cities team. If you're joining us today from a city and you're not a member of the Healthy Cities Network, please do reach out, join us. A little plug there for the programme. But thanks very much, Natasha. It's a great pleasure to have you in the studio with us today. The one person I haven't introduced, of course, is the chair of the Commission, who Natasha just referred to. Her Excellency Katrín Jakobsdóttir, former Prime Minister for Iceland. Katrín, thank you so much for joining us today, again, here in the studio. We have a very packed programme today, so I'd like to hand immediately over to you to take us on from here. Thank you.
Well, thank you, Rob, and thank you, Natasha, for your very kind words. It is really my pleasure to be back with you all today for this very important consultation with local leaders representing cities and regions. And I think Natasha gave a great overview of what we are going to do here today. We will explore practical solutions at the local level to address the growing health impacts of climate change. So to get started, it's my great honor to welcome Rosamond Adu-Kisi-Debra to today's consultation to highlight the vital link between climate and health. Rosamond is an internationally recognized advocate whose tireless work has brought global attention to the human cost of air pollution and the urgent need for climate action. And her personal journey, marked by profound loss and extraordinary courage, has transformed into a powerful call for justice and healthier environments for all. And we are very privileged to hear her insights today. And Rosamond, your advocacy began with the story of your daughter, Ella Roberta, a clear reminder that inaction can be a matter of life and death, and a catalyst for rethinking how we shape healthier cities and the ways we live in them. And reflecting on her legacy and your work to highlight the health impacts of air pollution, how can ambitious city-level climate action be designed to not only reduce emissions, but also to deliver immediate health benefits for communities, especially the most vulnerable? Please, Rosamond.
Thank you very much for having me. 5 years ago, I was actually in court right now around this time. And Ella remains the only person in the world to get air pollution on her death certificate. What I didn't take lightly was the coroner's recommendations. And last Thursday, we just put together all the parties that the coroner wrote to. So all the royal colleges, the Mayor of London, the Chief Medical Officer, local councils, and I got them all together in a room. We had a first summit in 2022 where everyone was asked to go off and go and see what they could do about the coroner's recommendations. Now, in my journey, data as a scientist is incredibly important. If you want, and also it is incredibly important to get doctors, everyone in health on board with your vision. Unless you get that, I'm afraid you won't really get much done. And you also need people in high places like the Mayor of London who supported Ella's inquest to actually be on board with your vision. My vision is that no child will die from asthma linked to air pollution. It is an enormous task, but looking at the Scandinavian countries in Norway, Sweden, I believe London can actually get there. You need a lot of allies in your corner. As one person, you can't do it, but you also need people to believe in you. And I use data to show the children who are dying, the children who are being admitted to hospital, and what needs to be done about it. We know that clean air zones actually work. And we know that if bold action was taken, my late daughter is more than likely she would still be alive. No child should die from air pollution. We know that to be, but can this be stopped? Yes, it can. Also, on my journey, what I have learned, it is very important to bring local people with you. They need to understand why certain measures are taken. You can't just put things in and expect everybody to understand you. So where I'm heading now with the Chief Medical Officer is, we know there needs to be a public health campaign to educate everybody about the detrimental impact of air pollution. WHO tells us 7 to 8 million people die prematurely, and it's very important to mention that word, prematurely, every year. And you need to communicate this at a local level, national level, and a worldwide level. And also when you bring in initiatives like Clean Air Zone, like the London ULEZ, you need to show the audience health benefits. COVID has taught us that everybody cares about their health. So you need to communicate, and your messaging needs to be incredibly powerful. What do you also need? You need the law on your side, because you may have to take action. I work with governments, the UK government, who've just come out since Monday. We are now in line with Europe when it comes to PM 2.5. And what you have to show is, by them not acting, more people are going to die. They are going to spend more on health. Governments everywhere, and this is a message to governments everywhere, they spend trillions on healthcare. And my message to all of them is, by taking action, people's quality of life will be better. We know in the UK, air pollution costs our economy 27 billion. And if you factor in diseases like dementia, that can rise up to 50 billion. So the Chancellor, for instance, she can't afford not to take action. Everyone has to take action because they need a strong workforce. People are getting ill. However, we have shown through ULEZ that people are much healthier. So I think we lead by example. We communicate to people what we are doing. You need people in health, i.e. our Chief Medical Officer backs my actual action, what I am doing. And I continue to have dialogue with all the Royal Colleges. Last Thursday, I got together people from GPs, pediatric, midwives, because we know children are also the most vulnerable. There is enough evidence out there. There is about 70,000 studies linking climate and health. We can always have more research, but there is enough research there for us to start acting. I think action is what is needed rather than research and research and research. And people are coming on board. You know, at the last mayor election, air pollution was number 3 when it came to Londoners. So they do want healthier lives, and that's where we are heading. Next year, we hope there will be a public health campaign. We're going to start off small in London to show the rest of the UK. You must always do things, you know, as a scientist, you start off with a pilot and then you expand wider. And I think when people see real action, i.e. there are less appointments going to their GP, people are feeling better, people can get to work. That is how we lead. You must lead by action. Definitely, and that's for all cities. And I think they can use London as an example. We have the biggest clean air zone. And I know people were very cynical. They thought the actual mayor would actually lose the election. But he showed by being very bold and being very brave, he actually increased his majority. And I stand firmly alongside him. And so does everyone in health. You must get doctors on board because people trust doctors. Doctors have a close relationship with their patients. And I urge doctors to continue to talk to their patients about this matter. So it's not a one-person thing to do. As the coroner showed, we need the Department of Transport, we need DEFRA, and we also need the Department of Health. And actually, I am going to be writing to the Education Secretary because we need to educate children in schools. This is not just a one-person thing, not any one department. And I, as an advocate, I work with everybody. And that's what I have learned in my 5 years since Ella's inquest. It is a difficult job, but I believe we will get there, truly indeed. Thank you very much.
Thank you, Rosamund. Thank you for your courage and generosity in sharing your personal story with us today. And your experience reminds us that climate change is not an abstract issue. It's a matter of human health. It's a matter of human dignity and justice. And by linking the public health challenge of air pollution and climate change to the very real consequences for families and communities at the local level, you have not only given this discussion a human face, but you have also inspired us in the Commission and at the WHO to enter very concrete action. So on behalf of the Commission, we are extremely grateful that you could be with us, and I do hope that you can stay online and take some questions after the next two interventions. And moving straight on to London, because now I'm very pleased to introduce Mette Copan, Deputy Mayor of London for Environment and Energy, overseeing the Mayor of London's world-leading climate action for the capital. Deputy Mayor Copan, welcome and thank you so much for being with us on behalf of London. After hearing Rosamund's very powerful reflections, as a leader in a C40 city that has pioneered ambitious climate action for health, how are you drawing on these lessons to address the new and emerging challenges at the intersection of climate and health?
Yeah, look, let me firstly start by taking the opportunity to thank you all and the WHO for bringing all of us together today. Such an important topic. I think the first thing to say is, firstly, I want to recognise Rosamund's contribution to helping improve our city, to making sure that it's more equitable in terms of how do we make sure that our climate action is really felt by everyone. And I think that's the first thing to recognise, right? Ella's story reminds us that the impacts of climate change and of pollution aren't felt equally across the whole population. There are people across our city and across the world who are paying the price for a crisis that they didn't cause in the first place. People who are having to grow up with stunted lungs, in Ella's case, obviously having lost her life in such a tragic way. People who are living in overheated homes and struggling to cope with heat. And we saw that this year in London, where we had 4 extreme heat waves for 4 long sustained periods, where people who are elderly, those who are younger children, those with underlying health conditions are suffering worse from it. So I think the first important point to recognise is that climate justice has to be about social justice, about racial justice, but also about economic justice too. And any efforts to try to seek climate justice has to be really embedded in the principle of how we can redistribute wealth to the communities who've done the least to cause the crisis in the first place. I think what we see, and I think the role that cities and regions can play, which is why C40 is such an important organisation, is that cities are doers and not delayers. And what we've seen yet again in Brazil this year is, whilst there were important progress that was made, we have seen yet again progress but not change that we need. And the reality is there are people across the global south who've done the least to cause this crisis, who are desperately wanting that change, but yet again wasn't delivered from COP30. In contrast to that, what we had was the C40 Cities Summit, where we brought together over 300 mayors from over 300 cities, which put forward a yearly offer of action of tangible actions that they're going to deliver in the next 12 months. So we're not talking about, high-level aims and ambitions. Of course, there is our climate action plans too. What we're talking about is actually specific tangible actions that each city will deliver. And what we've seen also is that C40 cities are cutting emissions on average per capita 5 times faster than the global average. So you can see how the difference that cities are making each day out. I think what's really important is the health story is how you win hearts and minds. I think Rosamond spoke very eloquently about this, talking about how you can actually gain public support. And what we've seen here in London, we delivered the world's largest clean air zone, which Rosamond spoke about, which is the ultra low emission zone, which has transformed the lives of Londoners. For the first time, when the mayor first got elected in 2016, experts from King's College London told him it will take 193 years for us to reach legal limits if we change nothing and carried on the way that we did. As of this year, for the first time, because of the bold transformative action that we've taken, we've been able to reach legal limits for the first time in London in just 9 years. And that doesn't happen, from coincidence. It happens because of the coalition and the alliance that we built together here in London government, but also working with advocates, campaigners, local councils, and those with the knowledge to really take us forward around that. But really at the heart of that has to be about how we communicate to Londoners about the impact of these policies. So for example, how are we talking about the impact of our policies when it comes to hospital admissions, to cost to our economy, to cost of sick leave, and what does that mean for people working? So I think all of those impacts are all showing us positive signs, which we're communicating with Londoners that helps us win us much more support in what we're doing. The other key aspect of what we're focused on here in London is about how do we prepare our homes for the impacts of climate change and the health aspect of that. We have a huge problem in London where we have, loads of old, densely populated social housing, in many cases, which are damp and mold, again, having direct impact on people's respiratory health. And actually, tragically, we've had people who've lost their life because of damp and mold in their homes here in social housing in the UK. And we have a huge effort to try to retrofit our homes, both in terms of making sure that our homes are much more cooler in the summer, but also warmer in the winter, so residents don't have to choose between heating and eating. But actually, fundamentally, retrofitting isn't just about the cooler and the warmer aspect. It's also about having healthier homes. It's also about improving the indoor air quality that we have for our residents in London. And we've been doing a lot of work. Again, recently I'm actually going to go to visit a school together with Rosamond in this month, later on this month. But we've rolled out over 200 indoor air quality filters, again, to try to improve the health aspect for young Londoners here across our city. Look, there's many examples that I can give you around what we're doing here in London, but really what I'm trying to say here is that, really at the heart of this has to be around equity and the social justice piece. And I think part of it is about storytelling. I come from a campaigning background. I used to focus on getting young people registered to vote. We registered over 500,000 young people last year. How you reach people is by going to them. Where do they go to in their day-to-day social, digital lives? How do we connect more with young people? How do we make sure that we actually tell our stories through actually Londoners? That's the most important, and that's what we've seen really works here in London. And I think cities have such a huge and important role to play in actually leading our mission to tackle the climate crisis. And our call to national governments, but also to to big convenings like COP30 is give us the power that we need, but also give us the resources, because we're already doing it, and just let us get on with it and actually make a difference for our residents across the world. Because we're no longer living in a distant threat of climate change. We're seeing the impacts of it everywhere across the world, and it's no longer time for progress. It's time for change. So thank you so much again for inviting me, and look forward to the conversation.
Thank you so much, Deputy Mayor Coban. And I think your words really showed us that cities are the architects of our health. They shape the air we breathe, the streets we move through, the green spaces that cool and connect and restore us. And they influence how we travel, the food we eat, the noise we hear, and even how we cope with heat waves. So from Rosamund, we heard the devastating human cost of air pollution. London has showed us what's possible when cities lead. Another place, Utrecht, is often described as a living lab for healthy urban living. Cities are the beating heart of creativity and progress, and Utrecht is often described, as I said, a living lab for healthy urban living, and that is why I am so pleased to introduce Mr. Haas Bakker, Deputy Minister, Province of Utrecht. Can you tell us, Deputy Minister Bakker, how Utrecht is really implementing innovative and integrated approaches to climate action and health? What make these policies and actions ambitious and different? And what results are they delivering for healthier lives?
Good morning, and thank you very much for having me and having us here. Very pleased to contribute to your discussions this morning, hearing very interesting things for this moment. And I'm very pleased to share some examples of how we work on the nexus between climate change and health and what we are doing. And I brought some pictures and some examples to you. So I'm seeing if I can share this with you. I think I can. And now I have to put this one on. If you can see, I think, my slides right now. Yeah, perfect. Now, let me first introduce you very shortly on the Utrecht region, because it's a very small region. In the European perspective, it's small, but we are a province of 1.4 million inhabitants. And we have larger cities like the city of Utrecht and Amersfoort, who are working very hard on the health and all policies initiatives, but we also have a lot of rural areas and a lot of nature, for example, and agricultural companies. So a lot of diversity on a small area. And within that small area, and that's why I'm bringing this one, I think a lot of the people here that are here today know this graphic. It's show your stripes. And we see actually here the global temperature change from 1815 until last year. And it's becoming more and more and more red. We see it as a region. I think everyone here sees it, that the weather is changing. The weather elements, the climate elements are becoming more extreme. So we are facing heat waves. We are facing drought. We are facing floodings. We have more pressure on biodiversity, and we see all this is linked to health problems as well. So in our provincial vision, our environmental vision 2050, which we are updating right now, we say it's about 3 elements. Safety, this is at the heart. We see health and healthy policies is at the heart, and we say we want to be future-proof. So I think the 2 words that pop up in mind are resilience. We have to be more resilient, and we have to be more prepared. We have to be prepared as a government. We have a lot of universities, applied sciences, other institutes that are really day-to-day working on this subject, but we also have to take the population on this matter more by the hand and helping them. This is why I'm showing you this picture, because this is actually a picture where we can see that we are facing heat problems at a more yearly level. And with heat, it's also the drought that is coming. And what we did as a province is that we helped all the 26 municipalities in our province, helping them to get vulnerable groups to give them more information and more tools how they can deal with, especially in the summertime, heat problems. So we make heat plans for all the municipalities, and we make heat maps. So we are linking climate adaptation with social care very directly. And this problem is not in mind in the Netherlands yet. It's always we are talking about rain problems, but the temperature is rising, and we see that the effect on health problems is increasing. So that's one of the first examples I'd like to show you, is that the linkage between heat and social care and protecting the most vulnerable is a key element of what we are doing. The second is about designing cities and regions for life. What we are doing, we depave and green as many streets, regions, schoolyards as possible. So in the last 2 years, we helped and subsidized 150 projects with subsidies, but also with our knowledge and expertise in creating approximately 90,000 square meters of new green space in the province. And you see what really helped is when we combined all kind of initiatives and subsidy streams at one focal point, in which we say it's about a green and biodiverse environment, it's about a healthy environment, and it's about a climate adaptive environment. And that combination works. So that would also be my advice to you. Look to integral policies and combine those things with each other. What makes me, as a regional minister, but also as a father, very happy is our initiative with greening the schoolyards. Because you see trees, you see plants, but what you also see is smiles on the children's faces, because they like it more to play outside in a greener and water-friendly environment than on concrete tiles. And that's also an example of the combination between good policies and linking it to what people are doing and to the children's environment. Last example I'd like to show you is about citizen science. This is a Horizon Europe project, Urban Relief. And residents are measuring temperatures during 2 summers in their neighborhoods and contribute ideas on where greening is more needed. And that data which they are collecting is used to depave and green street and improve local plans. And you see this is a way on how we get the conversation started, and we can attract people, also young people, with looking and measuring their environment. We as a province are a partner with municipalities, but also with NGOs, and we are really working on future results. And it also makes us a more inclusive and evidence-based climate adaptation province. So I think this is a really good example how we are working together with residents and how we are making it also a little bit more fun to do. So I'm stopping my slides and I'm coming to an end. I hope I showed you some examples and very tangible examples how we are working day to day with municipalities, with NGOs, with all other partners to a greener environment, more climate adaptive, resilient environment, but how health is at the heart of all what we are doing. Thank you.
Thank you so much, Minister Hasbacher. And now we have a few minutes for our commissioners to pose some questions to Rosamund, Metekaban and Hasbacher. So the floor is open for you, and I already have the first question from Omnia. Omnia, I'm sorry, I always use the first names because I come from Iceland, but Omnia, please.
Thank you so much, Prime Minister, and also thank you to all, and so good to see you, Rosamund and Mette. We were just together in an event last week, and one of the questions I had, one of the key outputs of the Commission involves engaging ministers of health and health secretaries, and for example, at COP28, more than 151 ministers of health signed a declaration on climate and health. And my question to you is what recommendations would you like us to make to them? And how can these leaders best support cities and communities through their action on climate and health? But also, as you mentioned, Mete, what can ministers of health learn from cities like London and from the incredible partnership together with Rosamond, and how can they apply these lessons in their plans and actions on climate and health at the national level?
Thank you so much, Omnia. To make the most of our time, we will do some questions and then I will pass the floor for you to give some answers. And Sandrine Dixon de Cleve, you are next.
Thank you so much, and thank you for this fantastic opening. I think it couldn't be more relevant also coming out of a series of meetings in Brazil, having been at C40 and the excitement that we felt actually at the summit in Rio. I wanted to bring up the disconnect that we're seeing between the national, state, and obviously city level. And to see, and this comes back to your very good points, Mette, around the need to meet citizens where they are, and the fact that actually there is a direct contact between citizens and mayors and local administrations. How is it that we as commissioners, who are also ambassadors on so many other areas in the area of climate, and who feel that actually health can really now anchor some of the pushback that we're seeing on climate, but re-centralize and rethink the importance between people's health and climate? What for you would be a priority area that we could collectively work together in, where we could really meet citizens where they are? I think this is a fundamental moment in the way in which we address climate. As a quick anecdote, and then I'll leave here, Madam Chair. Last week in the European Parliament, we saw members of the European Parliament cite the Bible as a reason why man-made climate change doesn't exist. And so I think collectively, we need to think through how is it that we can counter this real slippage in the way in which we're looking at climate denialism and the types of tools that are being used to push climate denialism. Thank you.
Thank you so much, Sandrine. I will have time for one more question. And Katuna, you have asked for the floor. So that's the last question in this round. Please, Katuna.
Thank you so much. I will try to be very short. My question goes to Mr. Becker. First of all, many thanks for your impressive presentation and describing the measures, what you do to make quality of life of people better. But my question would be about the construction policy. So the Netherlands is quite a densely populated country, and you described really very important measures, what you are doing to increase green spaces and make the city greener, and how you balance this with the construction policy of the city. Thank you.
As usual, time is very short, but I will pass the floor to Rosamond, Haas, and Mette now. 1 minute each to reflect on those questions. And Rosamond, are you there? If we would start with you.
Yeah, very important. After this meeting, I'm actually going to be writing to the health secretary. I think what people need to do is you must get the politicians involved. I had a meeting with Mr. West Streeting, and he's actually put some of this in his actually future plans. So you need to be on side with the politicians. It's quite a hard ask, but the other people you also need to engage is scientists. Now, because of Ella's inquest, I've managed to engage all of those people, and I must admit it is a unique situation, but we can learn from that. My good friend Arnold Schwarzenegger would actually tell me to actually tell you he feels environment over the years hasn't worked. What works is health. He is a fantastic advocate on health because everybody cares about their health. And it was fascinating for me to go to LA. You know, after 15 years of being a governor, he is still out there pushing health. Health and social justice is what connects with the people. You can't deny health because the statistics are all there. What you need to do is get those doctors on board to advocate for you. And that will be my 1 minute. Find someone like Mr. Schwarzenegger and get your health minister on board. But please, data is crucial. And luckily for me, my background is science. So I took advantage of that. So you need to understand the data that is in front of you. That is very important. People just don't believe when you just spiel off things. They have to believe in what you're saying. So you need to read your brief. You need to get proper scientists who are doing research in this area. People need to see you with them. I actually work for Imperial now with Frank Kelly, who's the top person when it comes to air pollution. They see me with Sadiq Khan, the mayor of London. They see me with West Streeting. And I work across parties. I don't work with just the government. I work with everyone. And that is an actual lesson which I have learned.
Thank you so much, Rosamund. And Has Bakker, next, your minute.
Thank you very much, Madam Chair, and thank you very much for the questions. I'm making a small combination, I think, on the questions, because I think what's really important, and that's why I started with show the stripes of climate change, is that we must stop working on climate mitigation. I see a shift towards climate adaptation, which I think is a good thing, but we have to fight for every 0.1 degree temperature drop. And it's not only the right thing to do, but it's also a smart thing to do. And when you make the combination to health policies, because it's, I think, all about prevention and resilience. And I think that's the way also the health department is thinking. How can we prevent the major increase of costs? So also make a business case, I would say. The question about the construction of the cities, I think that's a challenge for us. What we did is we made a covenant with governmental parties, but also construction private partners on a future-proof building. So we are building lots of houses and with that a lot of infrastructure. But we say, and all of the signing parties say, it has to be future-proof, climate adaptive, biodiverse, greener, attention to water friendly. So I think this covenant is a real example, and now we're looking to the national government to have it a national policy. So that's my wish.
Thank you, Has. And Mette Koban, you get the last minute in this segment, please.
Yeah, thank you. What Rosamund didn't tell you is that she went to gym with Arnold Schwarzenegger, which made me very jealous. That's probably how you win hearts and minds. Look, I think, just to sort of quickly answer Sandrine's question, I think it's a great and important question. I think look, I'm going to be honest with you. I'm not a traditional environmentalist, but partly the reason why I agreed to care about this issue is because communities like mine were more impacted by it. And some of the learnings that I take from my community is often when we talk about the impact of climate change from very much the sort of the doom and gloom perspective, which we have to, right? Because obviously the world can't wait. It feels really overburdening for a lot of people who feel like they're one person who hasn't caused this crisis. And it's like, but now you're putting this pressure on me to fix something that I didn't cause in the first place, right? And I think part of what we've got to do is we're not just doing, like, if you think about all of the things we're doing in London right now, we're not doing this because we have to because of climate change. We're doing it because why wouldn't you want to live in a city that has got more access to green space, more cleaner rivers, better air quality, more cooler homes in the summer or warmer homes in the winter, where you're going to save money on your energy bills, so that extra hundreds of pounds could make a difference of you going out for a dinner with your family or that dream holiday that you want to go on your family. So I think we have to talk about the green transition as an opportunity. It's actually, to excite people about the transition. And so I think part of our messaging when we are reaching people is not just the sort of the overburdening of the impacts of climate change, but it's like, let's excite people and let's bring culture, let's bring music. Next year for London Climate Action Week, I'll just say this and I'll end it here. We had the biggest London Climate Action Week this year, over 700 events. It was like the Glastonbury of climate weeks in Europe. And what we are going to do in this next year, in Trafalgar Square, we're going to create a big cultural moment where we're bringing together music stars, celebrities, really trying to bring people who aren't in this space to really inspire Londoners about how we can actually, they can reap the benefits of the green transition. So I think opportunity has to be a big part of this conversation.
Thank you so much, Mette. And now we move on to the next person on the program. I'm very pleased to introduce Professor Mark Nieuwenhuizen, Director of the Urban Planning, Environment and Health Initiative and the Climate, Air Pollution, Nature and Urban Health Program at IS Global in Barcelona. Professor Nieuwenhuizen is widely recognized as a world-leading expert in environmental exposure, epidemiology and health impact assessment. And his work has been instrumental in shaping our understanding of how cities can foster healthier urban living. He brings a strong focus on the intersection of climate, environment and public health. Professor Nieuwenhuizen, thank you so much for being with us online today and drawing on the scientific evidence. How can climate mitigation and adaptation solutions at the local level deliver multiple health co-benefits? And considering the conversation we just had with local political leaders, how do these findings create political opportunities, as we mentioned here before, for action? Mark, please, the floor is yours.
Many thanks. It's great to be here. Many thanks for the invitation and for the great conversations we already had before. I mean, they're so important. And, some I want to re-emphasize through the short presentation I do. I just want to emphasize that, we're focusing on individual cities, but we have, as you know, many cities in Europe. With different sizes, different contexts, etc. So every city needs a bit their own solution. Here I showed a picture more of the EU, where I can show the cities. One of the problems we have if you want to do it for the rest of Europe, often this kind of data is not available yet to do analysis. So one of the things is kind of the lack of data to actually take good decisions. And that's what I would like to emphasize. Now, we've heard quite a lot about the effects of air pollution, the health impacts. I mean, we know that there are up to 200,000 deaths in our European cities each year because of air pollution levels. And of course, you have to realize that death is the tip of the iceberg. Under that, there's a large burden of disease. I mean, when you talk about cardiovascular disease, respiratory disease, asthma, what we heard from Rosamond, but also, for example, like dementia, that's linked now to air pollution, and it's tremendously, expensive for society and also very impactful for families and society overall. But it's not only air pollution what we have as a problem in cities, it's also the lack of green space. In those 1,000 cities that I just showed, I mean, we estimate that there are 43,000 premature deaths each year because of the lack of green space. Also, we have noise problems. Noise levels are often too high. 60 million people suffer of excessive noise. And then we also have the urban heat island effects and excessive heat, but also contribute to about 20, 30,000 deaths each year in our cities. Those are the current burden that we see in our cities, and with appropriate, efficient, effective climate action, actually we could reduce this health burden considerably. Also, what we see, as what I said, there are many cities, different sizes, but also different configuration of cities. Here, in research that we did, we divided up our city using a data science approach into 4 types of cities. On the one side, on the left side, you see the compact, high-density city. On the other side, the green, low-density city. In between 2 other forums. I won't go into detail because of time, but often we think about the compact city, high density city as the most sustainable, best city type we admire, what we would like to have. But what we found at the moment is that, yes, when you look at CO2 emissions per capita, the compact city does the best. It produces much less CO2 per person when you compare it to the green low density city. But then when you look at some of the other factors, like traffic density, nitrogen dioxide exposure, so air pollution, excess heat, the lack of green space, it's actually much worse currently in the compact cities. Also, we see mortality rates that are higher actually in compact cities than in green low density cities. To a large extent, this excess mortality can be explained because of the higher air pollution levels, because of the lack of green space, because of the excess heat. So again, what we actually would need to do is, or what we need to have is this high density cities, these compact cities, but without the sources that cause the disease, without the factors that cause the disease. Now, one thing is what I showed on the previous picture, still our compact cities are very, as a high traffic density, and what we should try to reduce that by actually reducing or shifting car use to, for example, cycling. On the right, you see here a picture from Utrecht where they've done this very effectively over the years, where now I think 80% of trips are actually by bicycle. We looked at 167 cities in Europe where we looked at the relationship between the percentage of people cycling, of trips by cycling, and the availability of cycling infrastructure. And up to about 25% of cycling mode share, so 1 out of 4 trips done by bicycle. There's almost a direct relationship between the availability of safe cycling infrastructure and the percentage of people cycling. So that means, to me, is that you need to have safe cycling infrastructure to get the people to cycle. So you need to invest in this, that people take the bike. When you go to higher levels, actually, there are other factors that become more important. I mean, cultural factors that may account for that. Also, I estimated that in these cities that if all the cities, if in all the cities 1 out of 4 trips would be by bicycle, we could prevent more than 10,000 premature deaths each year because of the increase in physical activity that people would have. Also, we know that cycling produces much less CO2. I mean, we did a survey with this. This was part of the PASTA project, where we found that when we looked in a cohort of people to daily travel, I mean, 70% of this was contributed due to car travel and only 1% to cycling. And, overall, we see that cyclists have a 84% lower life cycle CO2 emissions than non-cyclists. So there's a big advantage of trying to get people to shift. And often that could be possible because about half the car trips that we have in Europe in our cities are less than 5 kilometers that could be easily replaced by cycling. But it's also how we look at our public space. I mean, we have to think that, streets are public space. I mean, how they use this. Often what we see, our cities are too car dominated. Much of the space is given to car while we should use it for other things. And there are now new types of what I can call novel urban models, like the low traffic neighborhoods in London, the super blocks in Barcelona, the car-free neighborhood in Germany, in Vauban and Freiburg, Germany, and also the 50-minute city, where they rethink how we use our urban space, what we do with our neighborhoods. Also, what we've heard before in London, the low emission zones are very effective reducing air pollution levels. And I think there are now 300 low emission zones around cities in Europe. That to go into this a little bit more, for example, my own city, Barcelona, they were trying to introduce the super blocks. Unfortunately, only 3 have been implemented so far. Sant Antoni is one of them, where you see pictures here at the bottom, where we saw after the implementation a real reduction of air pollution, more physical activity, etc. In this kind of super blocks, you can implement them when you have, neighborhoods with grid systems, what you see on top of it, where you have cars going up and down, left and right. And the idea of a super block is that you cut 4 junctions in a block of 9, and then you only allow walking and cycling within the block, and also put in more green space. So you get a much, pacified, what we call it, area where people can enjoy actually more the city. As what I said, only 3 were implemented, but we estimated that if all the 502 super blocks would have been implemented in Barcelona, that was the original plan, we could prevent almost 700 premature deaths each year because of the reduction in air pollution, because of the reduction in noise, the excess of heat, and then also the increase in green spaces and the increase in physical activity. The physical activity is underestimated because we only looked at some part of the physical activity. We didn't have estimates at the moment. But you can see redesigning your neighborhood, your area which you live is actually can introduce a much healthier living environment where people are less likely to die or also less likely to get disease. The other thing is the urban heat island effect. We know that the city centers often are much warmer than surrounding areas, can be about 3-4 degrees. It's particularly a problem in the south of Europe, but the north, probably we're going to get this soon as well. And in 100 European cities, we estimated that 4% of summer mortality is attributable to this particular urban heat island effect. So where the city centers are warmer than the rest. Currently in those cities, there's about 15% tree coverage. And we estimated that if you increase the tree coverage from 15 to 30%, you can reduce the temperatures on average by about 1.3 degrees and prevent about a third of the excess summer mortality in those particular cities. So again, by planting more trees, making it more greener, actually you can get a healthier population. Now, what we often see, unfortunately, is in cities, is that there are silos. We see health working on one part, public health. We see on the other side transport planning. We see housing. We see urban planning. We see the education sector, and they all work within their own silos, very specialized, without actually talking enough to each other. Fortunately now, because of climate action, because of climate change, we see more working together with different departments because they recognize it's an overall threat. But still, mostly you see this is not happening. And for example, what you see in the education sector is that many cities, 60-70% of kids are still taken to school by car. Well, they should be actually going by themselves, walking, cycling, or taking public transport. And often people say, oh, it's too dangerous to go to school walking because there are so many cars. So you get this kind of things. And I always say, also the public health physicians, I say, go and sit on the committees of the mobility in the mobility department or the urban planners, talk to them to tell them that health, they're the main health professionals in a way. They determine what's happening in the city because of health. The other problem, what we see, is there are many levels of governance. If I look here at my own city, Barcelona, what you see kind of at the bottom, they can do some things, but it's often also governed by other governance levels above them, what they can and can't do. You have many cities are part of the metropolitan area, where a lot of the traffic comes from. They have their own rules, have their own legislation. The province, we have the Generalitat here in Spain. What is the autonomous region? We have the Spanish government, we have the EU. And, a lot of these kind of layers of governance have some rules, and they are important what's happening in Barcelona city. We are often asked by the different layers to say what does it mean for health when we do something? Well, actually, they should be all sitting together. And then I must say that also you have the citizens under the Barcelona city councils, and they're not often, or most of the time they listen to, but not always. Citizens want something else at times what the Barcelona city council wants. Particularly if you come, let's say, to air pollution is always very high on the agenda of citizens, but then the Barcelona City Council thinks about other things that I think take priority. Now, one I think initiative that's kind of encouraging in Europe is the EU mission on 100 climate neutral and smart cities that try to be climate neutral over the next so many years. where they put in many climate actions, so they bring people together. Unfortunately, I think what's still a bit missing is health. Health doesn't come in much. I mean, it's all about climate action, what they introduce. And I think this is a bit of a missed opportunity. And I encourage the health sector, the health professions, more to get involved in this mission and emphasize that it's also all about health. Fortunately, we see many cities go in the right direction. There are many changes. An example of my city here, we had a big roundabout that distributed the cars throughout the city. That's what you can see here. They actually tore this down, put a smaller tunnel that allows less traffic into the city underground, and now there's a nice park. So we have actually less air pollution, less noise. We have more green space in this particular area. It's a poorer area, so it's there also. It's important for equity. So, but I think you see many examples now in other cities. So we're in the right direction. But there's still much more that can be done, and also much faster. I think, unfortunately, it's not the speed. The main message I would like to give is that climate action is health action. Climate action is not about the environment, it's about our health. And I think that's very important. And if you want to read a bit more, and published an article in The Lancet last year around this theme. And I think it's very important also to tell citizens that this is actually the case, is their health. So thank you very much. We're working on a project around us, the 1,000 Cities in Europe UBD Policy Project, and also Catalyze, what's a project around climate action in Europe, where we bring in these things together and try to create more sustainable, healthy cities in Europe.
So much, Mark. This was hugely interesting for our commission, and a lot of interesting points you made there. Now, as usual, time is short, so I will actually allow 5 minutes for questions from the commissioners. So please raise your hand if you want to ask Mark some questions. And I already have a question from Connie Hedegaard. Connie, are you there?
Just a question for the professor. Thank you very much. You mentioned these high density cities. And I assume that with more and more EVs coming in, noise is reduced, CO2 air pollution is reduced. But I wondered whether you have examples of cities where they already have a very big penetration of EVs, where we can prove that it actually helps. It could be Oslo, it could be Bergen in Norway, some of the cities that have had a very big uptake of EVs. Do you know of such statistics that we could use?
I know that it's Oslo, but I'm not in favor of EVs, to be honest. I mean, yes, they reduce CO2 emissions, they reduce air pollution on local source, but they still keep producing air pollution as from particles from the tires and also from brake wear. EVs are more are heavier. Also, what you see with EVs, they still take up a lot of space, public space in our cities. About 60% of public space is taken up by cars, road space. I mean, that we can use in a much better way. Also, sitting in a UV doesn't give you any physical activity. It's not good for health. I mean, it doesn't solve traffic congestion, traffic jams, what we see. So I think EV should be a last resort, particularly in our cities. I mean, if you go to our countryside, it's different. But in our cities, we need to really use public transport because you can do it cost effective. Distances are much shorter. You can get people to cycle. You can get people to walk. I mean, forget about cars in cities. I mean, they should be really a last resort.
Thank you, Mark. I only sadly have time for one more question, and that goes to Hans Brunix.
Thank you. Thank you, Catherine. Thank you, Professor Nieuwenhuizen, for that great intervention. I've got a question. We are now at a time period where it's all about speeding up and scaling up solutions. You've been talking about solutions that have a lot of support from citizens, that are cost effective, that create better and nicer cities. a lot of cities are part of networks. There are oodles of networks of cities that do this type of stuff. What is the key element that is slowing down this positive revolution that could be happening in cities? What are the key elements of governance that you think should move to speed up and scale up this positive view on the future?
Yes, I think politically, particularly, I think you were also yesterday at the Clean Air Forum in Bonn or the day before, and I think there's a bit of a misconception and disinformation about climate action, reducing air pollution levels. I mean, it's seen as costly. It's actually not costly. Not taking action is very costly, but we see too many politicians. They think that economic progress is about competitiveness, promoting industry. I mean, let the cars drive. Actually, that's quite costly in terms of health cost, but also in terms of labor productivity. I mean, the OECD published a report over the summer where they looked at the relationship between ambient air quality and labor productivity. And what they found was that a third of the increase in labor productivity in the EU was actually due to the improvement in ambient air quality. This was through, reduction in sick leave, particularly when you think about building workers, people working outside, but also improvement in cognitive function in high-skilled jobs. Air pollution is not very good for your brain. It's got many detrimental effects, and you can actually increase people's productivity, work productivity, by reducing air pollution. I think this knowledge is not going through our politicians, what have very short-term views, very limited knowledge often. Fortunately, not all of them. I think there are very progressive ones as well. But, a healthier living environment for people is much better for our economy. I mean, it's much better for everything which you can think of. But we need to spread this knowledge and make sure that they all understand and don't go for these short-term gains, but look at the long term.
Thank you, Mark, very much, both for your intervention and your very good answers. Now we will take a very short mobility break before we enter our next segment.
What shapes our health the most? The places we live in, the air we breathe, the communities we build, the streets we walk, the parks where we play. But our cities and their health systems are threatened by a changing climate. Vector-borne diseases are appearing, taking hold where they were previously unknown. Poor air quality, floods, heat waves, wildfires. And with them comes the trauma of loss and anxiety about the future. These are not just headlines. They are health emergencies hitting our most vulnerable the hardest. But solutions exist. Local communities, regions, cities, and networks are taking action. They are key to shaping how we withstand rising temperatures and extreme weather events. They respond fast. They build resilience. They know what works. They know climate action brings health benefits. Cleaner air, safer streets, healthier cities for healthier people.
For our next segment on advancing action toward carbon-neutral cities, we are joined online by three distinguished city leaders. Mr. Martin Horn, Lord Mayor of Freiburg, Germany, and President of ICLEI Europe. Ms. Anna-Lisa Boni, Deputy Mayor Bologna, representing the European Committee of the Regions, and Mrs. Julia Lopez Ventura, C40 Cities Regional Director for Europe. And they will share practical strategies and innovative approaches for creating carbon-neutral urban environments and explore how cities and regions can accelerate progress despite political and financial challenges. Now, I'd like to ask our commissioners to hold their questions and comments until after each speaker has finished. And after all of them have finished, we will open the floor for a broader discussion. But to start off, I would like to welcome Lord Mayor Martin Horn. Mayor Horn, ICLEI supports cities across Europe in advancing sustainable development and climate action through an integrated approach aimed at systematic transformation. Now, what do you see as the key drivers of this transformation, and how does ICLEI incorporate health considerations throughout the progress?
Yeah, thank you, and best regards from Freiburg in the southwest of Germany. My name is Martin Horn. I'm the mayor of Freiburg for 7 years already, and Freiburg is very close related to the French border, 4 case, and to the Swiss border, 40 case. So it's like we love cross-border cooperation, and we've got that international approach. Personal comment at first, I'm really sorry, but I've got a medical treatment in 30 minutes. So this is why I have to leave after my message. It's a pity. I'm really sorry, but otherwise it wouldn't be possible. And coming back to your question is, I mean, ICLEI for more than 35 years, our DNA has been in its integrated approach, moving behind isolated projects and one-off actions to drive systematic change that connects climate, health, nature, equity. And we know that our citizens don't experience these issues like in a separate way. So neither should our policies do. And factually, most interventions address several of the aspects mentioned above. For instance, a very simple one, a tram line is usually not just a means to ensure people can move around, but also helps to improve air quality by reducing emissions or contributing the urban greenery with tracks on grass. In Freiburg, we have green lines everywhere, and they are in fact completely normal to the people over here. This integrated approach remains one of the strongest driven of impacts in our cities, and ICLEI, as one of the leading networks of sustainability around the world, we've got 5 pathways: zero emission, nature-based, circular, resilient, and equitable development. And that serves as a shared compass, let's say, for systematic change. And with all pathway ultimately addressing health of people and the planet, they challenge us not to improve individual systems in isolation, but to redesign them so that sustainability and human health advance together. And by placing health at the center, they remind local governments and mayors of their fundamental responsibility to ensure a high quality of life for everyone and respecting a healthy environment of the other end. And there's a luckily a growing understanding, I'd say on a local level. I'm missing that growing understanding on an international level, let's say. And this is why we need an integrated approach, energy, mobility, adaptation, health, procurement. None of these can succeed in isolation. When we coordinate our work and departments, we create a momentum of coherence. So that's needed to act at the scale and the speed our communities expect. And the work, however, does not only depend on the local level. Shared governance between all governmental levels is a key principle through which local governments are empowered to step up their essential role in this process, this needed process of transformation. And therefore, we need a clear and open communication on all impacts of each step in the transformation and a coherent and positive narrative. And part of this is showing our residents results that they can see and they can feel that they are linked with their everyday needs. Cooler streets on hot days, cleaner air for the families, affordable, healthier food environments, safer routes to move from the city, parks, green spaces, and nature around that back into daily life. And this transformation that ICLEI supports is a kind of everyday support. And this transformation, we as mayors and local leaders, we have the responsibility and the opportunity to lead and to make this difference. And health is not a separate and standalone issue for our cities. It's a core value embedded across a very thematic area of ICLEI's works. Climate mitigation is very important. Adaptation, nature-based solutions are, in my opinion, a very, very key factor. Mobility, air, circularity, food systems, social equity. I mean, that's highly important. And at the end, it's all for one purpose: to ensure that every action we take generates a real health benefits for our citizens and for the planet. And there could be, like, I could mention different examples, from mobility and transport to housing, but also, I mean, just as one example, just 2 weeks ago, I, as president of ICLE Europe and mayor of this beautiful city Freiburg, together with 20 other European cities and regionals, we called on the European Union to maintain the ban of combustion engines to fossil fuels for a new vehicle. At a time when communities continue to suffer from the impacts of climate change and air pollution, and cities across Europe are proving that phasing out polluting vehicles is both feasible and beneficial, amongst others, for clean air. And air pollution remains one of the most urgent health threats in our cities. And I could name some examples. Just think about Brussels. There is like a low emission zone is highly important. Sorry to laugh a little bit. And so through nature-based solutions, we are creating places, and obviously where nature protects and heals. So we have the idea of small green oases, we call them, and also food systems. It's about medical health requirements directly in public procurement. We need environmental responsibility, but also with social and health benefits. Here we go. It's a win-win-win situation. And global platforms like the Cities with Nature, recognized by the Secretariat of the United Nations Convention of Biological Diversity, help us to track the real results of this work. It's not about goals, it's about real projects. That's my understanding of local politics. And finally, I would say we know that none of this will move forward unless health becomes an explicit political priority. And this is why I would like to highlight the health call to action launched by ICLE together with the mayors of Lahti, Lyon, urging European policymakers to apply a health lens to environmental policy and urban development. And the message is aligned with the World Health Organization's recent report on strategic approaches, thank you for that, to urban health. And it shows that the cities are leading the way. In my opinion, I mean, I have to say that as mayor, cities and mayors are sometimes faster, or a lot faster than national governments. And I mean, think about extreme heat, air pollution, or the pandemic, not to mention that too much, but I mean, that's like the link between environment and health. It's impossible to ignore that. And this is why we have to move, we have to act, but we also have to involve our citizens. So this is the last part. Citizens' participation is essential. And also in our case, as the city of Freiburg, it's a long-term experience that we try to involve them as much as possible, not as a strict part of the technical agenda. It's kind of like a full-scale part. And then we call ourselves Green City of Freiburg, but we understand us as a sustainable city. And this is why we take climate protection very seriously, but also adaptation. And Freiburg is the southest city in Germany, but it's getting hotter and hotter. And this is why we need climate adaptation and a heat action plan. And we created a map of cool places in Freiburg, and we have a 5-year program. For example, in winter times, we have a cold bus for homeless. In summer times, we have a heat bus for homeless. Also, I mean, that's one output, or schoolyards and outer areas, daycare centers. I could mention many more projects, but in summary, last sentence, with the participation of many stakeholders and the population, I think at least we try to develop strategies and concepts to bring them to real life with a direct positive impact to our local people. And this is, thank you for your work for the conference. Best regards from Freiburg.
Thank you so much. I know you have to leave. Maybe if I can hold you for 1 minute more and just ask you, because we are seeing a growing pushback against climate action. You are describing citizen participation in Freiburg. You know, is that the narrative that this commission should emphasize, or do you have other suggestion on what we should emphasize to reach different stakeholder groups in our upcoming recommendation to really inspire cities to accelerate climate action and climate commitments. But you only have 1 minute, so maybe from the top of your mind.
So health is the unifying narrative. If we talk about clean air for our children, safer streets for the families, for everyone, nutritious food, schools, cooler neighborhoods. So this is why people understand health, because it's related to their daily life. And this is why it's highly important. I do agree to 100%. And this is why we really have to kind of like to champion this integrated, health-centered and systematic approach towards sustainable development. Here we go, 45 seconds.
Thank you so much. Thank you, Mayor Horn. And next we have Deputy Mayor Annalisa Boni from Bologna, also representing the European Committee of the Regions. I would like to ask you about Bologna, one of the 112 mission cities selected by the European Commission to advance decarbonization. Could you just quickly describe what Bologna is doing within the scope of this project?
Yes. Of course. Thank you very much for this invitation. I'm so happy to be here with you and exchange, and also see some former colleagues from other networks and environments. So very happy. I'd like to just, if it's possible, have a quick set of slides, if you don't mind. Just to be also faster. I just wanted to put in presentation. Can you read it? Can you see it? Okay, fine. The first point is just to pick up what has been said till now from 9 o'clock. This is a clear message now. It wasn't before, but it is now clear. Health and climate are two sides of the same coin. They are completely connected. Now we can't talk about climate without thinking and talking about the impact on health of people, and the other way around. So that's really something that has, I think, evolved, even if there is so much to do. So about this mission that you have asked, and what we do as one of them, it's 112 in Europe and 100 in the EU. Basically, it's a first because basically what's happened, it's a realization that cities are the places, right, where climate crisis is already affecting people's health and people's lives, yeah, in very concrete ways. And it's also the place where, let's say, solutions can be found. I mean, in terms of impacts, we've heard all that in the previous presentations, heat waves, floodings, and we are really the center of both of these, the spread of new diseases, air pollution, and chronic conditions. All of this also increases inequalities. We know that also very clearly now, and all this is connected, as we said, to health and public health, by the way, because it's connected to inequalities. So, and that is concentrated in cities. And the Commission and the Union said, if we push the accelerator and we help accelerator of electric cars, I'm sorry, sorry. If we push the accelerator on, cities, then we help ourselves, then we help Europe. Because if we find solutions for these cities and we help them going faster, we give them 2030 as the target, then 2050 could be, is more easily achievable. So it's really about the role of cities, and that's why that was, the mission was launched. And in this respect, what I really want to underline, because different missions were launched, one on neutrality and so mitigation, and one on adaptation, but at the local level, the two things are very connected and very integrated. So anyway, whatever this mission or both missions are doing, achieving climate action and specific targets around climate cannot be seen as a project, yeah, but it's really a mission. So the word mission should really be underlined and used also by ourselves, by politicians, by our staff, by our administration, because it changes the paradigm. Why? Because it's not a project with, you know, a very linear way of working, a very linear, process. It's a collective effort through integrated policies and actions towards a common vision, a vision that has been described very well, where cities have to be seen as places focused where quality of life improves, where well-being of people and the planet are at the center. So it's a really strong transformative, let's say, initiative. It's something that has to be seen like that and not just like a sectorial or linear thing. And therefore, that's why it's just a matter of understanding how many objectives basically we are looking at. It's not only about reducing emissions, for instance, in this case around the EU mission of 80%, at least 80% by 2030, but it's also about changing your environment, making it healthier, making it safer, improving air quality. All this, you know, has been said by the previous professor, but also it's I can give the example of Bologna on the 30 kilometers limit. This was, you know, a big revolution in the city because people were so against it. Nationally, even our government stopped it. They said it was exaggerated to put 70% of roads and streets at 30 kilometers per hour limit. And, you know, but for us, this is making, you know, a safer urban environment. It's changing the public space. What the, you know, Neuhausen was saying, it's exactly that. If you change public space, then you change, you basically prepare or give at the disposal of people a place and a city that is much more, you know, less driven by cars and polluting vehicles and so on. And it's also about socioeconomic objectives and co-benefits, because the more you will push for renewables, the more you will have lower bills for people, and therefore you will also increase, you know, you will also fight energy poverty, you will create new jobs, and you will create also new opportunities for participation. I can go back to that in terms of governance. And you will also, like, co-benefit, maybe it doesn't talk to you, but it does talk to cities. It does also change internally the way we work, you know, having transversality. Again, the professors covered everything. Transversality, integration inside the municipality, thinking the budget in another way, cooperating, integrating, having a systemic approach. It's all Chinese for, you know, Italian administrations. So it's really, really helping, having a mission that is seen not as a project but as a mission is helping to also be more innovative in terms of procurement, in terms of many other things. So that's really like what it means in Bologna, in all these cities pushing for climate action in this way. And of course, I think having climate city contracts is also a very important new thing that is also having an impact on the governance of this, you know, complex endeavor, because basically you put together so many players. You have a lot of pacts, agreement, and things like that. The word contract was consciously chosen to basically underline the issue of responsibility, the issue of commitment, and therefore that's why it's an act. It's an agreement. You can call it agreement that is even if it's not legally binding, like the word may suggest, but it's sort of ethically, if you see what I mean, binding, because once you enter into it, you know that you go in with very specific actions that are quantified in terms of reducing CO2s, in terms of increasing, you know, renewable sources, renewable energy sources in the city, in terms of financial investment and so on. We also have not only a set of actions. In Bologna, we have 287 now actions of all the partners, but also an investment plan, which has never happened in the city before. You have an investment plan where you can see where the gaps are or where the investments already there are. We have 11 billions as a indicatively quantified, need in terms of capitals, which is not peanuts. So it cannot only be public, funded, but also needs some sort of, innovative financing system as well. So it's a very strong instrument that could be used for any other, in a way, mission. It may be adaptation, it may be housing, it may be other types of challenges that we face in a city, and that are, in a way, that need an integrated approach, and also it needs a federation of so many stakeholders. Here you only have an example, that's Bologna, and the list is not exhaustive, but it's, we just had the annual assembly of the climate city contract of the Alliance, and it's really like you've got the big ones, you've got the big utilities, but you've got the big companies as well, but also the small, you've got the airport, everything, the research, academia, you have the region. It's also about multi-level governance. We were talking, I mean, the last two slides of Professor Neuhausen was exactly that. It's the governance. You have, internal governance that is improved. You have multi-level governance that is improved, because you need to have, from the EU level, you were talking about COR, it's also the Committee of the Regions is also important to mention, the Commission, of course, which is the most important, with the Council and the Parliament and so on, going down, trickling down to the local level, and the national level is the biggest. You need to have a national set of policies that support these transformations. Otherwise, it doesn't make sense. It's really unfeasible. This is one of the biggest barriers in many, many countries. You were asking about what are the barriers, and one of these is multi-level governance that functions. And of course, governance also in terms of, citizens. And I always say that, to tackle the challenge of climate change, we need a climate of change, and only with a collective effort and an involvement of the communities, an involvement of stakeholders, an involvement of citizens, you can create this climate of change. And so for me, and that's my last element, it's really about changing the governance at all levels, as I said, internally, with other levels of governments, but also with the people, with the citizens. And we have lots of instruments in terms of participation, from the participatory budgeting, district assemblies or whatever. But we have had this experience in terms of citizens assemblies that has really been a game changer, in the sense that what we've done is to change our own statutes as a municipality, and we've had introduced in there citizens assemblies as bodies, as organs, of the municipality, like there is the city board, like we have the city council, and so on. And this citizens assembly can be activated by 5,000 people, or by the majority of councillors, and has to, let's say, revolve around specific questions that is asked to the city council to solve, and the city council has to take on board the recommendations. So the first one was done on the climate transition. We have selected the people who've participated in it, 100 people, through a very thorough methodology. It took us 2 years. We've gone through the elaboration of this, regulation of the assembly with environmental organizations, with civil society organizations. We didn't do it ourselves on our own, and in the end, we have set up something that may sound very complicated, but in the end it's worked. So you have 100 people selected randomly, but that are, let's say, then chosen on the basis of very clear criteria that basically help, as you say, allow you to have a very clear representation of the city and its society. So you have all the districts, all the ages, all the genders and so on. Also the city users, those that are not residents, but like students. We have 100,000 students in our city. So, you know, these kind of things. And these people have worked together through different phases. They have, first of all, passed from phases of learning, understanding the complexity of climate change and the climate transition, but not through our program, through an external committee that has decided to, you know, that's chosen what to, you know, they should listen to and learn. And then they deliberated. And all the proposals have been integrated to the City Council, which had by default to take the recommendations on board, and they could only say no to those that were, let's say, out of their competence. Okay, so that has really been game changers. And I think one of the recommendations I give at every level is to support these things, these new forms of governance, which also are, let's say, financially recognized, because the people who participated that were received a token like city councillors do for their time, and you know, this changes things, because only by involving people genuinely and with an impact of their action and in a correct way, not just the usual suspects, then you can really create ambassadors for change and game changers.
Thank you so much, Annalisa Boni. Thank you so much. I will ask you to stay online, because hopefully we do have some minutes for questions and reflections. But finally, I am pleased to introduce Julia Lopez Ventura, C40 Cities Regional Director for Europe. Welcome, Julia. Thank you for joining us. And could you tell us, how does C40 Cities support municipalities in the WHO European region to advance their climate mitigation agenda and scale up action across the region? And based on your experience, what are the major drivers of climate and health action that could be replicated elsewhere? And I believe that you have approximately 7 minutes.
Yes, thank you very much. And I will promise I will stick to the 7 minutes. Well, first of all, thank you to the World Health Organization Europe for the opportunity to join this important discussion. It is really a pleasure for me to be representing the global C40 Cities network today, with a focus in Europe, which is the region that I manage. And also thank you to Deputy Mayor Coban and Sandrine Dixon de Clef for the shout out to our work. And it was very good to see you both in Rio de Janeiro last month. Before I start, the key takeaway that I would like you to bring with you from my intervention is that the work of the Pan-European Commission on Climate and Health is vital, and that cities are ready to be your strongest partners. But let me unveil this in the next few minutes that I have. So for those of you that do not know C40, we are a global network of cities united to combat climate change. It was actually created 20 years ago by a mayor, the former mayor of London, Mr. Ken Livingstone, who at the time believed that the biggest global cities should and could achieve more and better together. The presidency now is back with London, with Mayor Sadiq Khan being our co-chair. And what Mayor Ken Livingstone thought at the time, 20 years ago, is now absolutely true. We now work with over 100 global cities, representing 1/4 of the global economy and almost 900 million residents. So in short, C40 Cities, we support our member cities in helping them work together, set ambitious climate joint goals, and helping them advocate for the policies, the climate policies that they need to succeed. To give you an idea of the ambition that we are seeking and seeing, C40 cities globally are moving 5 times faster than their national governments on their per capita emission reduction targets, which is actually something that Mayor Horn said he believed was the case. And I can tell him, we have the data. This is the case. Here in Europe, for example, the C40 member cities have collectively cut their emissions by nearly 23% since they peaked. And we have leading cities in this race. We have London, Paris, and Milan, for example, that are actually cutting theirs by over 30%. This is already a clear sign that shows that a cleaner, fossil fuel-free future, it's not just hope, but it's already happening on the ground. And this is why C40 and other networks of cities represented here today exist. We actually believe that the most successful action is and should be driven by a simple principle. Climate action must deliver better health and more equitable lives for everyone. We're seeing, you were mentioning actually that we're seeing lots of climate backlash. We need to anchor climate action in this guiding principle. Any climate policy, besides, of course, the much needed cut of greenhouse gas emissions, needs to be anchored to clear co-benefits, health being the most important one. You have asked me drivers for climate action and health together, and I would like to give you three that can be scaled across the entire Europe region, building on successes of concrete examples in cities. The first driver is clean air. This has been actually mentioned consistently throughout the presentations, and this has made me very happy. Clean air and public health through transport policy. The most immediate health co-benefit is actually improved air quality. And cities are already using innovative transport policies to achieve this. I would not like to repeat messages and arguments that others have consistently used, but I would like to mention one clear success story, which is London's ultra-low emission zone that was mentioned by Deputy Mayor Coban, actually, another speaker. The results of the ultra-low emission zone, the biggest in Europe and probably globally, are significant. In just a few years, nitrogen dioxide pollution in central London dropped by 65%. And it just happened in 9 years instead of the initial 193 years that were predicted without the policy. So this already shows that clear standards like low emission zones, consistently enforced, can deliver rapid and life-saving results. But going a bit east, because when I speak with mayors, some of them say, yes, but we are not London or we are not Oslo. Let's take a look at the east of Europe, actually, with Warsaw and their clean transport zone that was recently launched, the first ever low emission zone in the city. They were targeting the oldest and most polluting cars, 2% only, and they projected an 11% drop in nitrogen dioxide and a 20% in fine particle pollution. This actually demonstrates that change is possible throughout Europe consistently. Second driver, decarbonizing buildings, but with a social equity lens. We've been talking about transportation, energy, and buildings, which are the major source of greenhouse gas emissions in Europe, should also be considered consistently in climate policies. And for this, decarbonizing the energy sector and retrofitting buildings is essential. Staying with Poland, actually, Krakow, they delivered an anti-smog policy. It was once one of Europe's most polluted cities due to burning coal. But the city actually enacted a total ban on solid fuel heating that critically included what they called social shield to subsidize the cost of furnace replacement for low-income families. And actually, this combined approach, which for us is essential, led to between 20 to 40% drop in particulate matter pollution. According to the estimations, this saved almost 1,400 lives a year and result in 35% decrease in asthma cases. Barcelona, my hometown, so I was very pleased to see IS Global represented here as well. They started a network of energy advisory points aimed at tackling energy poverty. They set up these advisory points across the city to help vulnerable families make their homes more energy efficiency and actually help them understand their rights to energy, which sometimes it's not easy. Don't we all struggle to understand our energy bills? So actually this approach not only helped cut energy bills for up to 40% for thousands of families, but also it had the social angle because the energy advisors were actually people from the local community that became the advisors themselves, hired by the municipality. And I said 3 drivers. The last one is actually transnational governance and peer learning. So this is very important that cities by themselves, with the support of networks like C40 and others, globally, locally, nationally, regionally, we need to support them to share copy, it's important, and adapt these proven ideas. And this is actually the core of our support at C40. We need to provide them with research, data, and tools that they need. For example, we have developed a tool to quantify the health, economic, and climate benefits of action. So mayors can make the case for investment with confidence. We've talked about climate backlash. Mayors need access to data that can help them back up policies and gain the much needed trust and acceptance from the residents. Deputy Mayor Coban actually mentioned this, and Sandrine Dixon de Cleve as well. It is crucial to meet citizens where they are and with clear arguments, and I would add with their words. And of course, I would not like to forget the important role of advocacy at global and European level, where my colleague Annalisa Boni is actually an expert. We need to support European mayors to actively engage EU institutions to accelerate climate action. This is crucial, and unlocking funding for their measures. Pushing all the plans, like, for example, the upcoming European Housing Action Plan, to address critical issues like increasing housing supply, yes, but with a sustainability angle, to actually create better, healthier homes, or being part of coalitions to advocate for ambitious EU climate framework, especially in the challenging times that we're living, where we see lots of lobbies actually trying to avoid this. It is urgent that mayors are there supporting and pushing EU leaders to commit to more and better and more ambitious climate action. So in conclusion, and just in 10 seconds, the key takeaway that I would like, as I repeated, let me repeat what I said in the beginning. Cities are the engines of climate action and health benefits, both, and they cannot do it alone. They need support from other levels of government, as Annalisa was mentioning, but also the health community. This is new. Well, new. For the last few years, we've seen an incredible and much needed increase in this. The case studies that I mentioned from Krakow, London, Barcelona, and others are not isolated successes. They are a blueprint for rapid and replicable action. Thank you very much. I'll stop here.
Thank you, Julia. And now Annalisa and Julia are online, and I would like to invite our commissioners to share their questions and reflections from what we have heard from these local leaders. I will ask you, Annalisa and Julia, not to answer immediately, so we can actually have a few questions together, just to make the most of time. And I believe that Ernst Kuipers is first here with a question. Ernst, are you there?
Thank you very much. And these are wonderful presentations altogether, so I echo the previous comments. I have a question, I guess, in particular to Ms. Lopez Ventura. This is a wonderful network, and what we hear is really health is the main argument and should also be the main driver. Now, we hear many examples from, for understandable reasons, larger cities, cities with 200,000 plus or 1 million plus inhabitants. We also heard about 1,000 cities in Europe. How can you reach out to many of the smaller cities which may not have the overall capacity to put the same emphasis and the same energy into this? Thank you.
Thank you, Ernst. And then I will let Sandrine have her question.
Thank you so much, Madam Chair. And I agree with Ernst, another fantastic set of inputs. This has been such a rich conversation, really. I think it's so important. So I think a few things. And first of all, I want to thank Julia for all the good work that we've done together. And I agree with Ernst. I mean, C40 is an extraordinary organization, as well as ICLE and all the other organizations that are working together. And I guess my key thought, coming back to the inputs from Annalisa, is, and we've already given actually as the Club of Rome and Earth for All, an overview to C40 around how we link well-being, health, and the deeper thinking of alternative futures for cities. So I guess my question is, at this time, because we are seeing the pushback on climate, and we do know that health is an anchor, can we also then link that much more to well-being? And have you seen an uptake of some of the work that's been done by, for example, Kate Rayworth and the Donut in some of the cities? Is that the right approach? Or is it that each city needs to kind of adapt its own model to bringing in the broader kind of well-being alternative futures thinking? Last point, which Julia did not mention, but was mentioned actually by Martin, is this agility that the C40 mayors have. I mean, what was extraordinary in Rio was that we were able with Julia to quickly turn around a letter calling on the European institutions and member states to continue to promote and push ambition within the greenhouse gas targets, but also to address fossil fuel phase out. And it was incredible how quickly we were able to do that. So I do think that this is also, again, another area where we can really look at the agility of cities to be able to come together and be a voice for change.
I would like to ask Annalisa and Julia to reflect on this, but I will ask you to be very short and concise because I have more questions from more commissioners. So just maybe a minute each. Please, Annalisa.
All right, thank you. Yes, well, specifically like the donut model was, I think, was very ambitious and quite complicated to set up. But we've seen, I mean, achieving climate neutrality by 2030 is also very ambitious, but it's worked better because it's meant building on what exists and basically trying to evolve in the way you organize policies and you communicate policies and you engage citizens, so it doesn't go from 0 to 1,000 or black or white. It's like evolving. It's like adding little bricks. What I've seen in these last 3 years, it was really about adding bricks in different things, in how you do policies, how you talk about transport, how you talk about energy. You can every time you can just evolve in the way your narratives, in the way you work internally, in the way you do advocacy, in the way you create alliances with other cities or your government and so on. So it's really more about having a sort of house which you add bricks on it rather than building a whole new fabrication, a new building that you put down. You see what I mean? So it's
very helpful.
About, yeah, and it really helps you engage with people.
Thank you so much, Annalisa. Julia, would you care to reflect on those questions, please, very shortly?
Thank you. Lots of questions, and I know that we are short in time, so apologies if I'm missing any of the points. For Ernst, thank you very much for the compliments and for the question. We do believe that health should be the main argument, together with the economic case as well, which is very important in the challenging times that we live in Europe. And actually, we believe that we have the responsibility to support our mayors in helping them understand and get the much needed data to be able to quantify these co-benefits, both related to health and economy. And on your other question with regards to smaller municipalities, we have wonderful examples from Europe, like the EU Cities Mission, that have actually, in purpose, selected cities of all sizes and natures, and that we applaud and support. In the case of C40, we made a decision 20 years ago to work with the global municipalities because we believe they can act faster to cut greenhouse gas emissions. They can become the pioneers to inspire the others, but also this comes with a responsibility, and we work very closely with our member cities so that they can scale their results to their neighboring municipalities through entities, if they exist, like in Barcelona. Professor Mark mentioned that there was the Metropolitan Authority of Barcelona, composed of more than 30 municipalities, where Barcelona is holds the presidency. So they can channel all these learnings. Yes, smaller municipalities as well, and actually working very closely with their neighboring global cities. And for Sandrine, very quickly, thanks for the nice shout out. I really enjoyed this letter that we created in 30 seconds. No, that's an exaggeration, but 30 minutes it was. I think that we really need this agility from mayors, but this would have not been possible if C40 cities, the Club of Rome, Can Europe, and others were not in the room present to actually facilitate this ambition that we captured from the mayors. This is our responsibility, and we also need to identify clearly who are the allies. And I'm not only talking about the different networks working with mayors, I'm also talking about the EU institutions. The fact that we had such an ambition, European Vice President of the European Commission in the room, that provided the space for the mayors to actually show that hope was crucial. Thank you.
Yeah, the last opportunity for questions. I have a question from Linda Bregu. Are you there, Linda?
So thank you very much for this session. So actually I have 3 quick questions, although I think that Julia answered to the second one that I have. But the first one, I heard about the necessity of collaboration, communication in the experience of Bologna. So my, let's say, logic question would be, okay, when it comes to building these groups and communities in supporting the climate story, health related, but how many or how frequently did you face the pushbacks of the different narrative from the ones who consider that this is not a big issue or not a topic for the green cities? The second question that I had was related to how can the cities measure the health impacts that are linked to climate interventions. And I think that Julia just started saying that we need more data on that. But if you have any good experience happening anywhere, that might be of interest. And the last one, can you just point or figure out one big policy or important one that can change, be it on the EU or international level, that can really give some chances to the cities to be empowered tomorrow? So can you really identify one that is a necessity to be changed immediately?
Thank you, Linda. Julia and Annalisa, I will ask you to answer those very good questions in a very short way. So please, the floor is yours. Annalisa, first you.
Thank you very much. So if I understand well, how do we deal with those that are sort of not, they don't agree with our policies on climate? That's
or pressure against.
Okay, I mean, the one thing is, as I said before, working in terms of new forms of governance, authentic ones, helps generating not support, but empowerment. So you don't have, you can really see the difference between talking to citizens that have an idea that is often linked to their guts or their emotions, while having to deal with citizens that have gone through information, education, deliberation, like the assembly. It changes from 0 to 100%. So if you don't apply those things, you will always have the people who are with you and the people who are against you, and you will just have to balance, have, as strong narratives as possible, but it becomes, it becomes a hard fight because you deal with emotions and guts feeling and social networks and, social media, basically. That's the most dangerous and difficult fight to have, because a lot of it is really like without information, creating fake news, changing what you've said. So I really saw how 100 people that were either not believing in it or not convinced or not knowing or very strong emotional feelings became informed citizens and therefore understood what the complexity of the issue and have opinions that then with whom you can, relate, even if they're against you, but at least you can discuss purposefully. So, you know, that's why we're trying to engage people as much as possible in these kind of ways, because otherwise it's just a fight against fake news. Okay, and you will never solve it. And the other question was which policy needs changing with cities. I think if I understood correctly, for me it's more about understanding that cities matter at the EU level, and that means having a vision as a European Union, as a European Commission that looks at cities as allies in an integrated way. You know, so for instance, now this idea of the EU agenda for cities is definitely for me very important, because it will, I hope, guide funding policies. It should. Policies, funding, regulation.
Thank you so much, Annalisa. We really have to wrap up now. Thank you. Thank you so much. And Julia, a final minute for you to wrap up on the questions.
Thank you very much. So 30 seconds for each question. Just building on, so Mylinda, building on what Annalisa Boni was saying, I think that it's very relevant that we talk about climate disinformation very openly. What Annalisa was calling the fake news. How do we work with the non-convinced? They are exposed to this fake news, to this climate disinformation that is very well organized. And it's increasing. Now we are in a fundamental moment also inside C40, where we need to, together with our mayors, choose how do we work with this. Shall we continue talking about climate without talking about climate? I don't have the answer for this, so I will just leave you the question there for reflection. And second, on the second question, what is the next challenge in Europe? Well, in my humble opinion, I would say buildings and energy are crucial. We are at a crossroads right now with many crises happening at the same time. Housing crisis, energy crisis, the climate crisis, a change in global governance crisis. And citizens are in the middle of all of this. We cannot ask them to choose between the end of the decade and the end of the month, because we know what they will choose. That climate agenda cannot be on their shoulders. So we need to work very closely with mayors to support this narrative, this change of narrative that actually has been consistently mentioned throughout the presentations today. I think I exhausted my 1 minute.
Thank you, Julia. Thank you to Julia Lopez Ventura and Annalisa Boni for your interventions and your answers. And also thank you to Martin Horn for his intervention. But now we will move on. And our next speakers will explore how cities and regions can strengthen resilience to climate impacts and share effective adaptation strategies, going beyond nature-based solutions. And I'm very pleased to introduce Dr. Semil Tugay, Mayor of Izmir, Turkey, Dr. Anna Masturako, Deputy Regional Governor for Public Health, Region of Western Greece, and Bart Boutmans, Team Leader Environmental Healthcare in the Department of Health, Flanders. And I would like to first invite the Mayor of Izmir to address the Commission. Welcome, Dr. Semil Tugay. Could you tell us about the strategies Izmir is using to build climate resilience while engaging citizens, especially the most vulnerable, in shaping solutions that actually promote health and prosperity? Semil, the floor is yours.
Thank you so much. Have a good meeting for everyone. And it's an honor to represent Izmir as a Mediterranean city where the impacts of climate change, heat waves, coastal flooding, drought, and ecosystem degradation intersect every day with public health, social equality, and economic resilience. Our central question in Izmir has become very clear. How can we protect people's health while strengthening climate resilience? And how do we ensure that those most affected are full participants in shaping the solutions? Our approach rests on 3 pillars: participatory climate governance, nature-based and community-based adaptation, And third, a justice-driven resilience model that prioritizes women, low-income households, and high-risk neighborhoods. To make climate policy more democratic and science-based, we launched the Izmir Climate Citizens Assembly, supported by the European Union Civil Participation Fund and co-designed with civic partners. 50,000 residents received invitations. 50 citizens were randomly selected to reflect gender, age, socio-economic, and geographic diversity. They met in 5 structured deliberation sessions together with scientists, health experts, hydrologists, and urban planners. Their discussions focused on heat risk and public health, water scarcity, nature-based solutions, health equity and vulnerable groups, behavioral and community-level adaptation. The result was 30 concrete implementable recommendations, 10 of which have already been prioritized for integrations into our CCAP and upcoming health and climate action plans. What makes this mechanism powerful is not only policy output, but its health impact pathway. Residents become more aware of heat-related illness, water hygiene risk, and environmental health. Risk communication improves, trust in institutions grows, and climate actions become more socially legitimate. By listening to citizens first, we reduce maladaptation and align climate resilience with lived realities. I can give a second example as a community garden model, Kadife Kale community garden model. In Izmir, climate vulnerability is not evenly distributed. Women, particularly those living in economically fragile neighborhoods, face greater exposure to heat, food insecurity, and limited access to green space. Our flagship initiative, Kadife Kale Community Garden, developed under the Urban Climate Resilience Program, demonstrates how gender inclusion can reshape climate and health outcomes. 54 microplots managed by 51 women, producing vegetables, herbs, and culturally important crops. Measured co-benefits include nutrition. Households now consume 20-30% more fresh produce during harvest months. Participants report reduced stress, stronger social ties, and safer shared spaces. That means the better mental health. Local surface temperature measured as decreased level. Children and youth participate in climate-sensitive agriculture workshops and economic resilience. As an economic resilience, small but meaningful supplemental income from surplus produce. This initiative is not just a garden, it's a women-led climate adaptation platform that strengthens food security, social cohesion, mental well-being, and local stewardship of urban nature. We now view women's leadership as a core resilience strategy, not an afterthought. And I'd like to mention also our sustainable urban mobility plan. That also mobility health that protects health, we believe. Our newly developed sustainable urban mobility plan guides Izmir's shift toward low carbon, health-centered transportation. We are expanding electric public transport fleets. We are completing new metro and tram lines, reducing car dependence in dense street districts. We are building bicycle superhighways and walkable green corridors that simultaneously cool the city and promote physical activity. We are implementing low emission zones, traffic calming districts, and safe school streets. Some sustainable urban mobility plan is not only an emission strategy, it's a health strategy that reduces cardiovascular disease, improves air quality, and increase the daily physical activity of residents also. And I'd like to mention the town hall COP Izmir. It's a participatory climate diplomacy organization. We have localized climate diplomacy through town hall COP Izmir, making global climate process accessible to citizens. This model brings youth, scientists, NGOs, businesses, and community leaders to one table, strengthens risk perception and behavioral change, generates community mandates for adaptation actions, and ensures our local voice is present in global climate health discussions. This approach is now a reference for ICLEI's international network too. To summarize, Izmir's strategy is to put citizens, not systems, at the center of climate resilience. Climate policy becomes durable, equitable, and health-enhancing when vulnerable groups co-create solutions, women-led resilience initiatives, nature-based solutions heal both ecosystems and people, clean energy and efficient buildings protect households from both heat and energy poverty, and sustainable mobility creates a healthier, fairer, and low-emission city for all. This is how we link resilience, health, and prosperity for all. Thank you.
So much, Emil. Thank you, Mayor Tugay. And I will ask everybody to be very mindful of time because time is short. But thank you for a very interesting intervention. And now we bring in a regional perspective. I'm very pleased to introduce Dr. Anna Mastorakou, Deputy Regional Governor for Public Health, Region of Western Greece. Dr. Anna Mastorakou, based on your experience responding to the wildfires in Western Greece, could you share with us some lessons learned and what is needed by regional governments to prepare health systems for future climate events?
Thank you for the opportunity to contribute to this important event. I'm representing Western region of Greece as a part of WHO Regional Health for Network. Today, I would like to share key lessons for the devastating mega wildfire that struck Patras on August 12, 2025, an event that profoundly shaped our understanding of preparedness, public health protection, and climate resilience. Within just a few hours, more than 3,000 hectares of forest and agricultural land were destroyed, over 90 homes were damaged, critical infrastructure, local businesses, olive groves, and livestock units suffered extensive losses. Although we were fortunate that no human lives were lost, we faced numerous public health issues and widespread environmental contamination. Communities were exposed to dangerous air pollution, compromised water quality, and long-term ecological disruption. Open landfill sites continued to burn for days, causing prolonged and intensive deterioration of air quality. What worked in the critical hours, data-driven risk mapping, real-time meteorological forecasting was very important. These tools, civil protection alerts played a crucial role in safe and timely evacuation in communities. Unfortunately, for our case, multiple arson attacks occurred at the same time, stretching response capacities. Despite this fact, our hospital, some located inside the fire zone, remained operational and effective, demonstrating strong health system readiness. A state of emergency was declared, of course, by the governor of Western region of Greece. Citizens at that time needed clear, timely, public health guidance. So the warnings were about water safety, air quality hazards, and safe management of toxic ash. We used a One Health approach in our case, and it was very essential because it was mobilized very quickly. We have a network inside our government, so we address quickly water safety, air quality monitoring of dust particle PM2.5 for the lungs. We monitor toxic byproducts of fire, heavy metals, toxic chemicals, dioxins, furans. We have an issue with disposal of dead animals and protection of agricultural land. Also, we have the burning of a customs warehouse containing 550 vehicles, which created an exceptional complex emission scenario and required immediate petitions for the removal of the toxic waste of that region. These realities confirm that public health expertise must be central in climate disaster management. We did a mapping of the risk area inside our government, identifying vulnerable livestock units, boreholes, cultivated zones. Environmental monitoring continues in its time in ongoing study in collaboration with the University of Patras and the Democritus Research Center. And at the community, we did a speedometer screening, lung screening, that revealed an impact on 35.6% of small lungs airways amount affecting residents. That was a very big issue of common health. Psychological support programs were activated for residents and first responders. Community resilience was a critical pillar. One of the strongest lessons for this crisis was the power of a community knowledge. In villages where residents understood evacuation routes and had basic firefighting awareness, losses were significantly reduced. Prevention. Coming to prevention, this is a year-round responsibility. We save fire in the summer, starting for the winter. So we have to do fire break zones on the forest, land cleaning, placing water reservoirs and mountains, clear and practice evacuation plans for every village. And at the summer, we have to worry about flash flooding in the winter. The lesson here is very clear. The One Health network approach works and was a very, very good tool for this crisis. Clear, timely public health guidance save lives, and public health must be put in the front line of the climate change crisis. Health system resilience must be strengthened. Prevention requires strong public financing and infrastructure. Environment impact research is not optional. We have the obligation for this generation and the next generation to save lives, because eternal chemical now are out there. So we have our results. And community training and empowerment save lives. Looking ahead about our border, we think that the expertise, the knowledge exchange, and best practice help us all to build a more prepared and protected Europe. Thank you.
Much, Anna, really thank you. And as our next speaker and final speaker in this session, I am pleased to introduce Bart Boutmans to speak on the climate and health strategy on behalf of the region of Flanders. Now, welcome, Bart. What lessons can regions like Flanders offer on integrating health into climate adaptation strategies at the local level, particularly for heat resilience? And how can these approaches overcome political and governance barriers? And I will ask you also to be mindful of the time as the other speakers.
Yeah, so thank you very much for giving me and my colleagues of Flanders this floor. I have some few slides to enhance my talk. I will share them now. Okay, you should see them. So, first of all, we concentrate on setting the scene on a local regional level. What does impact of climate change on health really means in our region? How do we use the basic principles on preventive health policy to react on these health challenges? And I refer to the approaches of population health management, of integrated care, and health in all policies. Mapping this context as to the factors that determine the health impact of climate change, as well as mapping the capacity of our network to react. And these two are the basic first steps we conducted. Actually, we enhanced our environmental public health approach and prevention as a win-win approach to the daily concerns and the challenges of the health and care sector, of the local communities, and of the non-health policies. We are using these principles both on a mitigation and adaptation approach. In an explicit participatory project with all our stakeholders in the field of health, care, environment, and youth, we conducted a health goal on environment, in which climate change was a distinguished sub-goal. The strength of this approach lies within the validation of this goal in Parliament by consensus. In 2024, the mandate to take initiatives to detect, prevent, and combat the health impact of climate change was adopted in a decree. The utmost minimum in this legislation is the obligation to execute a climate health plan. To enhance local engagement, we used the decree on local social policy to support this plan in everyday procedures, not only projects, but everyday procedures, and assure the importance of taking into account the aspects of well-being. So think global, act local is anchored in a climate health plan that assures action on 5 policy building blocks. At the moment, we are preparing this plan for action using 2 roadmaps, one on carbon neutrality of the health sector and one on climate health resilience. For this, we are relying very strongly on our regional local policy joint, namely our local guidance, our ears and eyes in the field, the local stationed health makers on environmental health. They create a local regional policy platform. This is an idea now we are trying to set up between European regions to enhance exchange and good practices on the how to. So, inspirational, I'll conclude with referring to the beginning of all these initiatives, namely the first really visible excess mortality in the summer of 2003 in Flanders. We are 20 years later now. This was at the start of our heat health action plan in Flanders, using the urban environmental indicator on heat stress. We can see that the impact of heat on health isn't evenly distributed on a geographical level, for instance, between different residential areas in a city. This environmental health indicator predicts impact on a local level and directs our efforts to maximize health gains on adaptation and mitigation initiatives. And to really conclude, I'll make the why extremely clear again. We don't want to end up with a heat health cost in Flanders of 5.66 billion euros by 2050, a scenario that is a fact under the conditions of the most realistic IPCC scenario for Western Europe. And that's only heat, colleagues. Thank you.
Thank you, Bart, and thank you all, Semil Tugay, Anna Masturako, and Bart, for your excellent interventions, showing us not only what cities and regions can do, but also demonstrating the cost of inaction. so clearly. So once again, I would like to invite our commissioners to share their reflections and pose any questions you may have to our speakers. And we have some time now for questions and answers and reflections. So who wants to be the first to ask a question? I would like to begin then, because all of you are working on this in your everyday work, and we are talking about the pushback when it comes to climate action. And this commission that I'm chairing is thinking about really the importance of narratives, what narratives we could emphasize for different stakeholder groups in our upcoming recommendations. We have had consultation with the ministers of health in the region. Now we are having this consultation with the local and the regional leaders. So if I ask all of you, considering the backlash, not only the financial backlash, but also the political backlash, what narratives would you focus on? Please, you can start, whoever wants to start, but Dr. Semil Tugay, would you like to start?
Yeah, thank you. Thank you for the question. I'd like to say that we should choose some professional and some people from professional areas and some people from the public, including medical doctors, of course, health professionals, and also I would choose the mothers. I think they are very important people for the public, and also, of course, political leaders and some leaders from NGOs. Those were I would focus first as narratives. And I also would like to mention a little bit about the food system, because the food safety and security, it's very related with the climate issue, climate crisis. And we can expect a food crisis near future, especially in our areas because of the drought and heat waves and forest fires, many things like that. And that's why we should engage the farmers and the people from agriculture area, and those also would be better narratives for all of the problems.
Thank you so much for that answer. Now, can I hear maybe from Anna and Bart? Anna, please.
Thank you for the question. I noticed that it was a very, very good practice for us, the One Health network, because we have this network inside our government. This means that common health services we're talking with environment, with veterinary services, civil protection, agricultural services, and this avoid fragmentation in the time of crisis. And it was a very, very good tool with the support of University of Patras, because you have a memorandum of understanding, because we need scientific support. So it was a very, very good tool, and I think politicians could work on this, because it helps government, regional government, to act as a whole. Thank you.
Thank you, Anna, for that answer. And Bart, do you have any thoughts on this?
Yes, I want to emphasize on five key aspects. First of all, use positive communication. Very important. Think of the win-win principle. Secondly, engage the population in their own all-day settings and lifestyle. This means investing in community engagement. It's difficult, but it's the basis of everything. Thirdly, use a transparent framework for action, create mandate anchored in legislation, use clear environmental health goals, make impact visible, and for the politicians it helps to use the concept of a health cost in euros. And this must lead to a very practical roadmaps. Fourthly, enhance exchange of good practices on the how to for the regional level. Maybe we are seeking to the initiative on an interregional health makers climate platform and to enhance our learnings. And last but not least, we are learning that climate change often is a very controversial term. Often it's better to use terms in health risks due to climate factors to get the same impact, but more easily done. And in that way, I can state that a health governance on climate change is a very powerful instrument.
Thank you. Excellent points there made. Now I have a question from one of our commissioners, Sultan Rahim Sota. Are you there, Sultan?
Yeah, thank you, Catherine. Actually, I have one comment and one question. Regarding the comments, I think that, of course, I would like to thank all the speakers in this session and the previous session about the intervention and thoughts about how to build the climate resilient cities. And I fully agree with those measures. They have been presented and suggested, indeed. But my understanding that mostly they are about the soft measures, while from my point of understanding, building infrastructure also is important, because without infrastructure, having this fast urbanization, etc., so that would be very difficult to build climate resilient cities in the future too. Now about the question, it was mentioned by by a number of the speakers about that we are at the center of different crises now. The same we have the situation here in Dushanbe, the capital city of Tajikistan. Currently, we have been facing the energy crisis. So the population, even in Dushanbe, capital city, have been supplying the electricity, or population receiving electricity only 8 to 10 hours. It was not in the center part, but it's the rayons surround the Dushanbe, while the whole territory of the country, in the district areas, they receive only 4 to 6 hours per day. That is a big challenge. Another big challenge is transportation. So in my understanding, because of the fast urbanization, the water challenge is coming soon too. So my question is to maybe Dr. Tugay about how to build the climate resilience. So to which sector should be given the highest priority to build the climate resilient cities? Energy, water, transport, and of course, all of them will be impacting the health situation in the cities. Thank you.
Thank you so much, Sultan. I pass the floor to you, Semil Tugay. Can you reflect on these questions?
Yeah, I can say that the energy sector is the most prominent or most important sector related to resilient cities. In Izmir, we consider energy policy also as a health policy. Every kilowatt hour we save and every unit of fossil fuel we avoid directly reduces air pollution, heat exposure, and health inequalities. We have committed to 100% renewable energy use in municipal facilities by 2030, for example, and we are running the largest public building energy efficiency retrofit program in Western Turkey, improving indoor comfort, reducing heat stress, and cutting operation costs. Smart energy management systems in city facilities also help reduce peak demand and improve climate resilience during heat waves. What I mean, the completely all sector of energy, including producing and consumption, also both sides. We should manage very well because it's the most responsible area to produce the carbon, and also I think everyone needs basic energy, so we should focus and manage energy first.
Thank you so much. A very concrete answer to that important question. Now, Katuna Gogoladze, I think you have raised your hand. Please, the floor is yours.
Thank you, Catherine. So my question would be probably to Bart. So we talk a lot about the mortality rates coming from air pollution or heat islands, heat waves, etc., etc. Is there any scientifically proved evidence or proved correlation between the decreasing of green areas and increasing residential areas on the expenses of green areas? Do we have this kind of studies or proved information that there is some direct correlation between these two factors, if any? Thank you.
Thank you, Katuna. Bart, please, the floor is yours. And then I have one final question from our commissioners. Please.
The answer is very short. Yes, we have. I think there's literature enough to enhance the correlation between green spaces, or looking to green spaces, or being in green spaces, and health outcomes. Not only mortality, but mortality is the tip of the iceberg. Actually, we are conducting a study in Flanders, mapping the green spaces in the residential areas and linking it to the electronic medical files of all our people in Flanders. So 7 million people, 7 million electronic medical files. And the first results show that there is a correlation, surprisingly. So that's something we go to our politics with these data, and we have a mapping on a residential area, so we can steer where the biggest needs are. That's very important to. We put it online by the end of this year, so within a month.
Great, thank you. Thank you so much, Bart. I have a final question now from Sir Andrew Haynes, our Chief Scientific Advisor. Are you there, Sir Andy?
Yeah. So my question really is about building links between healthcare professionals and the healthcare sector and these broader public health initiatives. Obviously, it's very important to bring the healthcare sector and the influential voice of health professionals along with you. And I wonder if you have some concrete examples of how you've been able to capitalize on the support of healthcare professionals in enhancing and increasing the message about climate action and health in your own local environments. Thank you.
Thank you so much. Now I will give each of you 1 minute to answer that, and then we finish this session. So Semil, Anna, and Bart, each of you 1 minute to answer that. Semil, please.
I can say that the collecting data and then following the issue by monitoring the health data from people, the most crucial thing engaging by the health sector and health professionals. And of course, they should be aware for next crisis, and they should be more agile to manage the health problems related with climate crisis, including fires, floods, drought, and some new pandemics or something else. But we need data. We need really correct data to collect from all of the cities and from everyone. So we should handle it. That's the most important thing, what I think.
Thank you so much. And Anna?
We have an initiative from the professor of Pulmonology Clinic of the University of Patras, Professor Jouvelekis, with alert us about the danger, the possible danger to the lungs of the residents. So we did together this plan of the spirometry program in the communities. The first plan was were in the community. The second phase stage of the plan was about firefighters, police workers, and volunteers then take place in this firefighting. And the third stage was the spirometry program at the workers at the industrial area for Patras, which was at the epicenter of the region. And this was very important because this lung damage could be permanent. So we find the people that were affected and they have the therapy. So it was a very good intervention. Thank you.
Thank you, Anna. And finally, Bart, a short answer to the question on the involvement of health sector and health professionals.
Okay, the key message I want to pose is integrated care. It means taking along climate change and the effects of climate change also. This means physicians that implement epidemiology on their own patient population. This means getting the message from the nurses who take care in the homes of people. This means supporting elderly home care with resilient, heat-resilient measurements. This means subsidizing interaction on a climate basis, climate indicators for health and care initiatives. This means making green deals on a regional level with the healthcare sector and so on. There are lots of initiatives.
Thank you, all of you, Dr. Semil Tugay, Mayor of Izmir, Dr. Anna Mastorako, Deputy Regional Governor for Public Health from Western Greece, and Bart Mautmans, Team Leader from the Department of Health Flanders. Thank you for your excellent interventions. Now for our final segment, I'm very pleased to welcome Lord Mayor of Cork, Fergal Dennehy. The City of Cork will be hosting the Mayor's Summit in 2026, and it's a real pleasure to see you again and have you with us today, Lord Mayor Fergal Dennehy. Now, from the perspective of the City of Cork, could you share how local political leadership is advancing climate mitigation and adaptation solutions in ways that also deliver health co-benefits? And in particular, how are these efforts creating opportunities for political action and engagement at the municipal level? Please, the floor is yours.
Distinguished commissioners, esteemed colleagues and partners in city leadership, can I just acknowledge Councillor Tony Fitzgerald here as well this morning, our political lead for Healthy Cities in Cork and on the Irish Healthy Cities Network at the WHO, European Health Cities Network. And also we have Denise Cahill, the Cork Healthy Cities Coordinator, with me here this morning as well. As Lord Mayor of Cork, it really is an honour for me to join you here this morning and to share my perspective from a city that is proud to stand as both a WHO Healthy City and a EU Mission City on the pathway to climate neutrality. I speak not only as Lord Mayor, but as a representative of a city experiencing firsthand the realities of climate change and the opportunities that arise when we align climate action with public health leadership. Cork is a coastal city, which developed by the River Lee, shaped by its waterways and estuary, and increasingly challenged by its climate vulnerabilities. Flooding risk remains one of our most significant threats. Tidal surges, heavy rainfall, and river overflow are now more frequent and more severe. When these events occur, it disrupts daily life, it damages homes and businesses, and places immense strain on emergency response systems and critical infrastructure. We also face air quality challenges, in addition to rising number of heat waves, which place food production, older people, children, and those with chronic illnesses at heightened risks. These environmental pressures translate directly into health impacts, from food insecurity, increased respiratory conditions, to mental health stresses associated with instability and uncertainty. Consequence is a reduced quality of life for many of our residents, but in particular for vulnerable groups. This is why Cork has placed climate and health integration at the forefront of our city development plan. Our commitment to healthy urban planning under the leadership and stewardship of our Chief Executive here, Valerie O'Sullivan, emphasises resilience, sustainability and equity. The urgency is very clear. We must deliver solutions that simultaneously mitigate emissions, adapt to climate impacts, reduce vulnerability and enhance the health and well-being of our population. In Cork, we are already seeing how climate action creates tangible health co-benefits. We are on the cusp of launching a sustainable, healthy food policy, which promotes locally sourced, nutritious food, cutting emissions while strengthening the viability of local food producers and improving diets, as well as the food environment right across our city. We are also regenerating city centre infrastructure to build resilience, people-centred urban spaces, from flood-resistant public areas to expanded active mobile routes that encourage walking and, of course, cycling. These changes are not only climate smart, they foster physical activity, social connection, and improved mental well-being. Air quality remains a political and public health priority. Through investment in cleaner transport, expanded electric bus fleets, and safer cycling routes, we are working to reduce pollution and lower asthma rates, particularly among young and vulnerable people. These actions demonstrate the dual advantage of climate measures. They protect both our environment and, of course, our lungs. None of this progress occurs without political leadership. As elected members, we play a vital role, guiding consultations, approving strategic plans, and ensuring that community voices shape local decisions. Climate and health considerations are now embedded across portfolios, recognising that climate action intersects with housing, migration, social equity, economic development, and of course, public health. Of course, we face challenges. Financial pressures, behavioural change, complex governance structures, and the pace of the technological transformation. But Cork is addressing these by embracing evidence-based policymaking, building strong cross-sector partnerships, and maintaining a firm commitment to fairness, for transition must just be inclusive for all. Everybody must be involved in this. Colleagues, it is very clear that no city can address these challenges alone. So today, I issue a political call to action to mayors right across the European region. Ireland will host the EU presidency of the Council of the European Union from July 3rd to 31st of December 2026. In this context, I invite you all to come to Cork City on October the 5th and 6th, 2026 for the European Mayors Summit on Climate and Health to amplify at EU level the priorities for us all as city leaders at the forefront of tackling climate and public health issues. At our gathering in Cork, we will shape a unified agenda grounded in the recommendations of the Pan-European Commission on Climate and Health, recommendations that will provide a vital roadmap for integrated environmental resilience, urban health, and social equity. I urge you to endorse these recommendations and to champion them within your own jurisdictions. Let us build a network of cities that act decisively, collaboratively, and courageously. Because the truth is simple, our health and that of future generations depends on climate decisions that we make today. The strength of our response will depend entirely on our unity. Cork stands ready to lead with you. Let us move forward. Let us move together towards a healthier, more resilient, and a more equitable Europe. Thank you.
Thank you so much, Fergal, and thank you for this very strong political call to all the mayors in the European region, coming from the Lord Mayor of Cork, Fergal Dennehy. So thank you so much again. And we have now reached the end of our consultation with leaders of cities and regions in Europe. And Rob, you have been here the whole time with me, listening to what has been said. So very shortly, the lessons you take out of this consultation.
Yeah, what a super final statement by the Lord Mayor, and a call to action, and of course that very warm invitation to Cork in 2026, which we all very much appreciate, Lord Mayor. Of course, Rosamund kicked us off beautifully today with setting the scene very personally with Ella's story. She referred to data, leadership, law, and really resonated a lot of the messages we heard throughout from the other speakers, particularly about this health as a unifying narrative, which I think was how the Mayor Horn of Freiburg put it. Deputy Mayor Coburn of London was talking about framing, and again, Rosamund also spoke to this, framing the economic versus the health costs. They're not mutually independent. And of course, we have this pushback, and Mark Nieuwenhuizen referred to this as well, in terms of, we have these this leadership pushback sometimes that reducing emissions is not beneficial for the economy. And I think it reminded me of something that I heard yesterday at the EU Clean Air Forum in Bonn. And that statement, or that I believe is recounted a number of times, if you believe the economy is more important than air quality, try holding your breath while counting your money. And I think what a number of folks made this point today about health as a driver of change, and Rosamund calling for, we need more Arnold Schwarzeneggers. We heard that loud and clear, Rosamund, and thanks for that call. We need the champions at the table. She also talked to education, and that came up a couple of times as well. And of course, we bid her all the best of luck with her letter to the Ministry of Education in the UK. And of course, WHO would be very happy to help you, Rosamund, in, of course, supporting you with your letter to the State Secretary for Health on these particular points. Deputy Mayor Coburn also spoke to, of course, cities as doers and not delayers. And I thought that was something that, of course, was very well resonated by the Regional Director, Annalisa, a little later, around cities as the place where action happens. Of course, we are, or you are, a climate and health commission, and there were some specific recommendations that I heard emerging from this from these discussions as well. Mark Nieuwenhuizen talked to health authorities and physicians as being part of committees on health planning, and that was resonated by one or two of the speakers as well. He spoke to super blocks, which I was in Barcelona just 3 weeks ago. I walked around a super block. This was incredible. I would have been fascinated to hear from him why we don't have more uptake for super blocks. Mayor Boni was talking about from Bologna the mission. It's not a project, it's a mission, and the value of having a mission and that perspective, and again framing, very important in tackling climate change. We need a climate of change, which I thought really resonated. And citizen assemblies, you and the Commission were speaking to citizen assemblies when the Commission actually launched in Reykjavik. This came up again from Mayor Boni during her intervention. Then we moved to the final panel, which was, of course, the Mayor of Izmir was talking to these community gardens and was talking to gender inclusion, which I thought was a very important point in the sustainable urban mobility plans that they've introduced in Izmir. Deputy Regional Governor Mastoraku, that the importance of health, another very concrete recommendation potentially, the importance of health expertise in first line response, in disaster risk management and preparedness. Not many countries do this or have this sort of integrated in their first line response. I think this was a very important point that she was raising here.
Now I have to stop you.
Yeah, please.
No, because you have to wrap up. And
I've gone too long.
No, but everything you're saying is hugely important.
The last thing was Bart Boutmans.
Yeah.
He was recommending mapping green spaces and linking to medical files. I think we should watch that closely. Yeah. He said in the next month that would be launched, and so that they can gauge where the real needs are. And I thought that was beautiful point, maybe from
That's really an excellent wrap up, Rob, because what I experienced during this session, of course, I had to mind the time of everybody. Yes. But cities and local communities are so agile because they are so close to the people, they are so close to the citizens. So they actually can implement things faster, but they also see the results of their implementations faster. Absolutely. And I thought that was really what we learned in every section, how actually the fact that they are so close to the people and they actually see how health can be a key driver for positive climate action, because climate is affecting health everywhere in our region and everywhere on the globe. So I thought we had a lot of food for thought. Absolutely very important consultation. One point I would like to mention, because I think you actually mentioned so many good points. Okay, maybe 2 points, but the fact that we see climate action increasing labor productivity, reminding us that the cost of inaction is bigger than the cost of action. But also this phrase that was said here, we need justice-driven climate resilience, which reminds us that we must not forget the social dimension. But our time is up. So thank you all for joining us today in this consultation with cities and local communities. And the Pan-European Commission on Climate and Health will continue our work. Have the 5th consultation in January, and then we will be finishing our recommendations before spring 26. Thank you so much for your interventions, and thank you for listening in today.